nicely.
Okay. Arrange them.
Oh, that one's pretty good. This
Ooh.
one is not.
Tilt
Let's
a
do
little bit.
this.
Yeah, there we go.
And then let's do that.
Oh, look at you go.
What? Look at that. Great.
I don't
All
feel
right.
so short today.
No, you don't. You can go from the head. It's cold inside today, too.
I know.
I sit up tall and out of the screen.
I have to sit up tall now. Just got to grow a few inches. It's okay.
Hello, we're just going to share this real quick. Boom, boom. So if you're watching from the beginning, make sure you give us the thumbs up or let us know, are you on live, team replay? You can type it in below. Come on, computer.
Share to the group.
You sharing it to the community,
Yes.
the LeBauer PT community? Okay, great.
Yes.
We've been live for a minute.
Yay.
That's cool. On YouTube, it tells us how long we've been live.
Oh, I appreciate that feature.
Let me find why won't it let me share? We have one viewer.
Ooh, yay.
Yay, about to get started. All right, let me see if I can figure out how to share. Oh, I think I have to go into my profile instead of into directly into the page here. So let's go home. And our physical therapy.
Cool. Got a second viewer.
What's
hello,
up?
hello.
We are going to get started in 1 second. We're just going to share this. If you read in the description, you know someone needs to hear it, you can tag them or share this yourself. Let me just get this. Oh, I think I have to do that. Facebook makes it so complicated.
I know.
Share. There we go.
Awesome.
Boom. All right. Well, in case you don't know me, my name is Dr. Aaron LeBauer, and this is Dr. Herzog. And while we're real doctors in life, we don't play doctors on TV.
It'd be cool if we did, though.
It would be
It'd
really
a fun
cool,
job.
wouldn't it? So we're doctors of physical therapy, and I'm the owner of LeBauer Physical Therapy in Greensboro, North Carolina, with my wife Andra, and Dr. Herzog is our back pain, powerlifting, and movement specialist. And today, we want to talk to you about what it means to get a diagnosis, excuse me, especially for a pain or injury, and why you're not your diagnosis. Excuse me, I got the cough.
The cough.
The cough thing going. So, a diagnosis. So at LeBauer Physical Therapy, we don't. It's really difficult because we don't diagnose people with medical conditions. You come in with your knees hurting, you're not going to leave knowing that, oh, I've just got a torn meniscus and that surgery is going to fix it up right away. Mm-hmm. Even if I think you have a torn meniscus or rotator cuff tear or a problem in your back, you're not going to leave here with that as a diagnosis. One, because I'm a physical therapist. I'm a movement specialist. I'm not we're not medical physicians, and we're not diagnosis specialists. We are specialists in restoring your body to its full, amazing capability of moving and being strong in regards to movement. So why don't we, Dr. Herzog, why don't people leave our office? Sometimes we will give them a movement diagnosis, but that's not satisfying, is it?
No, because most people don't understand it, and if you don't understand it well, you can't explain it to your friends. So say you're at a workout class and they're like, okay, go do a bunch of squats or go do a bunch of burpees, and your knee hurts so you can't, your friends are going to ask you, oh, why aren't you doing that? Or the teacher might even ask you that. And if you don't understand kind of what's going on, you're just going to be like, oh, I just want one answer that everybody knows. So, oh, I have a torn meniscus, so I just want to tell them I have a torn meniscus, so I can't do this, I need to modify.
Right, versus my hip's unstable. Mm-hmm. And people go, what is an unstable hip? right?
Yeah.
It's not harder language per se, but it's not in the public domain of, oh, a hip's instability can not only cause hip pain or knee pain, it can cause a foot problem.
Or a back problem.
Or a back problem. Or a neck problem. It can do a lot of different things. So here's on our end, the problem is that people want a firm diagnosis to know exactly what's wrong with them so they can do something about it right away. Great. But on the other side of things is when people come in attached to their diagnosis, they become their diagnosis for 20 years, right? Like the person that says, oh, I've had a herniated disc for 20 years.
They heal.
Like my problem's going away. Yeah, herniated discs heal. There are pictures, you can go look at it online that show, right, herniated disc at MRI time, and 5 months later, it's not there. Or the ruptured disc isn't there. It heals just like a scab and a scar. So if the pain's there before the herniated disc happened and after it's healed, where's the disconnect, right?
Yeah, obviously it's somewhere else. We're missing something.
Right?
Yeah.
Somewhere else. So the diagnosis that you may have received or think you might want is just it's a medical term. It's a medicalized term that describes symptoms or location of a pain or a tissue, but that tissue doesn't always mean that's causing the pain, because our body's supposed to pop, click, crack, make noise, and damage doesn't always equal hurt, and hurt doesn't always equal harm. So where's the answer?
Usually movement.
Movement, right?
Or lack thereof.
Or lack thereof.
Yeah.
Here's the thing a lot of people don't understand. What I really want you to take away is that when you do get an MRI or X-ray, there are some important things that we need to know. One, is getting that X-ray or MRI going to change the way that we treat you? So if we think you have back pain and your back pain turns on and off when we move you and touch you, is an MRI or X-ray going to change the way we treat you and get patients better? No.
Usually not. No.
But if you're having weird symptoms, and I think there might be, it's persistent pain that is unrelenting, wakes you up at night, you have like bloody urine or stools or something like that, and I'm thinking like maybe there's some cancer here, and I'm not going to continue PT if someone's got a tumor or space-occupying lesion. That's a great reason to, indicates an MRI, it's going to change what happens. Are there any other things you can think of that results of MRIs or X-rays that might change the way we treat someone with pain?
Pain, no, usually just cancer, spinal cord lesion.
Yeah.
Those are the big ones.
So like
Maybe
bowel and bladder dysfunction or
Yeah.
numbness, those kinds of things. But for general pain, injury, even after an ACL tear, do I need an MRI to confirm an ACL tear?
No, we have great tests to do that. And you can also, survive and function without an ACL too. So
Right. What do you use to test an ACL?
the Lockman's test.
Which machine do you use to test it?
Look at these guys. These
Right.
are great machines.
Right.
Well, my eyes and my hands. Yep.
Right. So we use our hands and our eyes to see where the movement problem is and test and confirm where we know it is. So as soon as someone walks in the clinic, we usually know where the problem is. We have to find out, like I can usually see where a movement problem is. I don't know if it's the movement problem, right?
Yeah.
Then I use my hands-on tests and measures to confirm the problem. And if I think that might not be right and I need another test, an MRI, then we can get one. But generally it's not needed.
Yeah.
So the trouble is that people aren't satisfied with that. Why do you think people aren't satisfied with knowing that they have a movement problem or they can't, they don't know exactly where the problem is?
Yeah, because one, people don't like uncertainty. Two, I'm honest with people. So usually if it's a movement problem, it's going to take work to fix. And some people, they don't want to make time in their life to fix, or usually it's the time and the effort that they don't want to put in to fix. And sometimes people just want the quick fix. So they think like, oh, if I have a diagnosis, it means, I can just get this injection, this pain medication, or surgery, and poof, my pain will be gone. But usually that's not how it works, especially with surgery. Or sometimes it's just a temporary fix. So a lot of times we have people with the cortisone shot. They come in, oh, it worked for about 3 months, and then the next one only worked for like a month. Now they don't work at all, and I feel nothing. I walk out of the doctor's office and I feel the same. Or with surgery, it'll hurt for a long time right after the surgery as they're recovering, and then the pain might go away for a little bit, and then it comes right back, and then they end up in our office.
Yeah. What's routine surgery?
Ooh,
Say routine surgery. Yeah. Have you heard that one?
No.
So sometimes there's different practice patterns. Have you also
Yeah.
heard like bursitis? I have hip bursitis. Have you been seeing that lately?
Yes, and then turns out it was not bursitis. I was like, well, if it's bursitis, there's actual like fluid in there, and they can just drain it, and it's fine. And they're like, oh, they never drained my hip, and I still have pain. And
Right.
turned out it was a hip muscle problem, not the bursa
Right.
in the actual hip.
What was it that I said before hip bursitis? The routine surgery.
routine
Okay, so
surgery.
routine
Yeah.
surgery. So here's the thing: is like a few years ago, so I've been practicing here in Greensboro for 20 years. Or no, I haven't been here in 20 years. I've been here for 15 years. I was in San Francisco before. And a lot of patients come in, I have hip bursitis. Well, what does hip bursitis mean? It means the bursa in my hip is inflamed. Itis is inflamed, bursa hip. But even in Dr. Herzog's experience here, the pain and symptoms aren't at the bursa, right? They're somewhere else, and there's multiple places. That's the other thing that I think people are told is when I say routine surgery. So what is routine surgery? Well, routine surgery to myself as a patient or you as a patient is not routine because you're not getting surgery on a routine basis,
I hope not. Oh,
right?
gosh, yeah.
It's routine for the surgeon, and it better be routine for the surgeon, right? So I hear this a lot. It's like, oh, they said it's just routine surgery. Well, yeah.
Routine for who?
For who? So my point is that there's words and phrases like the diagnoses or descriptions of the procedures that don't always tell the full story. Like a routine surgery for back pain because I found out on the MRI that there's a result I'm not happy with that I've told can be fixed with routine surgery means to the patients how many weeks of recovery from a back issue, a back surgery or even shoulder surgery.
Well, they'll tell you sometimes they'll be like, oh, you'll be fine. You don't even need any rehab. I had someone with a hip replacement. They were told they didn't need any rehab, but usually they'll give you like a 6 to 12 weeks, and then you'll be fine, is what they tell you.
Yeah. 6 to 12 weeks after the surgery. That's just to recover from the surgery.
Yeah.
That's not to make you better, stronger, faster. And unfortunately, fortunately, there's lots of good surgeons out there who are great, and there's lots of necessary surgery. And then there's lots of surgeries that are done because people don't know that there are other options. They just don't know.
Yeah.
And so, number one, we want to make sure that you know there are other options to routine surgery. And lots of orthopedic surgeries are elective surgeries. They're not emergency surgeries. So give yourself some time. Surgery is always going to be there, and for some people, it is the answer. And why is this so? Why do you feel why is this so important to us to let people know?
Because I just want people to thrive and be their best self, and just to have like the best, I guess, make the best healthcare decision for them. So a lot of people, I hate seeing, oh, they wasted all this time that they could have been living like their life to the fullest, but they got a surgery that didn't work, and then they had to go, to all these different medical practitioners to try to just like get help to live their life.
Right.
And that's like time that they could have been spending living their life to the fullest, but they're just angry, in pain, and it affects like not even just like their active life, but even like their relationships, because people in pain, they're just like, angry and irritable usually.
Right.
And it spills over to every aspect of their life. So
Yeah.
that's why I'm passionate about it.
And it's something that I've been seeing over and over again because people don't know. And maybe we've done a poor job of letting you know that there are alternatives, because the not only is it not living your life to the fullest, but I've known people who've died after routine surgeries for back problems. There are people that get hospital-borne infections. We've had a patient who had post-knee surgery where it was a necessary one, but still had a hospital-borne infection that kept him out of his activity for months.
Yeah.
And so the side effects, there's the potential hope is that the surgery is going to solve the problem right away, and within 5 or 6 weeks, you'll be back to full activity. maybe. Like from my aspect, like not just the surgery is going to do that. And that would be the biggest possibility. The most negative things that can happen is that it doesn't solve the problem. Then it gives you a hospital-borne infection. You get, you bleed out into another part of your body. You lose feeling somewhere, which happens a lot of times, knee, hip, back, ankle. I mean, you lose feeling and you die.
I had someone who he had like a cervical surgery and he like had swallowing issues and speaking issues forever after that. Yeah.
I mean, and I've known people who have knee surgery and they can't feel the top of their quad. You know, well, I mean, that's just a complication. But the worst possible case scenario of seeing a physical therapist and seeing another physical therapist and seeing a massage therapist and a chiropractor and a massage therapist and a physical therapist and then acupuncturist and then maybe finally seeing us, the worst possible case scenario is it doesn't get better right away, it doesn't fix the problem, and maybe you're a little bruised or sore or more irritated or you miss some more days of work. Right? I mean, it's like that's the worst possible case scenario. So regarding all those things, wouldn't you agree that it's probably better to try multiple alternative techniques before we go down the surgery route?
Especially because, like you said, not every PT is the same, not every massage therapist is the same, not every chiropractor is the same. Because just because you try one doesn't mean like none of them will work. Right.
It's like eating at restaurant. I don't like restaurant. I ate at restaurant last night. It was really greasy and bad. I'm never eating at restaurant again.
I love that one.
Right? Shout out to my friend Dr. Chris Anthony from Tri-Synergy Chiropractic for that analogy.
That's awesome.
Yeah. So he's like, we have different restaurants. We're different chefs in different restaurants. But it's like, I don't, physical therapy didn't work. It's, a restaurant doesn't taste good. I think one of the reasons that we're down on this path about the surgery is that going back to the beginning, is when you are looking for a diagnosis, we're looking for an MRI. As soon as you get an MRI, you're much more likely to have more procedures and more surgeries and more healthcare expenses down the road. It's just a given fact, because we find something, we have to do something about it. I can't let you leave here with that thing on the x-ray. Right? I mean, it's crazy. So the diagnosis is just a part of the story. The herniated disc or meniscus or what else? Rotator cuff.
Rotator cuff is a big one,
It's just a part of the story. It's not the whole thing. So if you've ever felt like I need to have an MRI or an x-ray to know what's going wrong, just know that that's normal, but it's not necessary. You just have to be open to, a different explanation, figuring out, spending a little bit more time working hard to change your body so that you can be stronger, faster, better, and just get out of pain. What else would you say that people should know about wanting a diagnosis?
Wanting a diagnosis. I guess also kind of going off of your MRI point is if you're looking for something, you're probably going to find it. So that's the other kind of problem with imaging is that it's so specific that it'll tell you things kind of like we said that don't affect you and have probably been there for a really long time. Yeah, it'll find a lot of things, but it might not find the things that are related to the problems you're having. And some of those things have been there long before the problem started. And, maybe the pain or injury goes away and those things are still there. Or they don't really relate to each other. So what can you do about it, right? What would be the number one thing people should do if they hurt or were injured recently and haven't figured out, what's wrong? I would say, so even regardless of before you get imaging or even after you've had imaging, get a second opinion. So always see, what we can do to help serve you, or I'd say if it's not us, go see massage, chiropractic, PT to at least either get an opinion right off the bat and try it, or if you've had imaging and you're kind of second guessing it, get that second opinion. What if people have 3 or 4 opinions and they're all different and they're confused and they don't know what to do? And they're confused. I would say kind of like what you said, try the conservative option first before, because the worst that happens is we delay surgery a little longer. What kind of results should someone expect from 1 or 2 visits of physical therapy? I would say just a change, whether it's good or bad, because if it's good, that's great. But sometimes the problem does kind of flare up and get a little bit worse before it gets better. But that's just kind of telling us and your body that we're in the right place, we're doing the right things and making change. It's just going to take some patience and a little bit of time to get there.
because if we can reproduce the symptoms with movement or touch or some other, basically it's movement or touching you, whether it gets worse or better, it's like, that's good. That's a good sign. We know we can affect change. That unrelenting pain that never goes away, that's always there at night, wakes you up in the middle of the night, that's typically more of like an internal organ type of driven pain that you do probably need to get checked out by a physician, and an x-ray would probably be the first thing, or even diagnostic ultrasound, which is pretty quick and easy to do these days. So if you've been struggling with an injury or pain, you've seen multiple people, you don't know who to trust, and you want a second opinion, what we do with people like that, and for you, is to do these free total body diagnostic exams. We take about 20 minutes, we run you through our full diagnostic machine, which is our hands and our eyes and a movement screen. We take you through some movements, specific movements, and we talk to you about what is going on. And if during that time you feel like we can help you and give you a roadmap to getting better, you can ask to become our patient, and we will spend some time with you, treating you right away, giving you homework. So if you would like to get one of these free total body diagnostic exams, just comment below or send us a direct message or call us at the clinic. You can look LeBauer Physical Therapy on Google. You'll find us. It's 336-271-6677. And give us a call and just ask for some more information about our free total body diagnostic. We'd love to have you in, even chat with you on the phone and give you a second opinion, a first opinion, or even a 10th, and see if we can get you on the road to feeling better before 2020. And comment below, let us know your number one takeaway. Make sure you share this with a friend, either through the messenger or tag them below. And we'll see you on the next one.
Yeah, awesome.
Yeah, thank you very much.
Thanks, guys.
Oh, maybe it's just the X.
I was like, oh no.